Hello, my name's Jackie Edgecombe. I'm a registered general nurse. I've been at St John's Hospice since 2004. I did my nurse training in London and have spent several years in various hospices around the country. I've mostly spent time working in the hospice at home department at St John's, but also I've worked in the inpatient unit and as a CNS. Patients tend to slowly, gradually, over a period of time, withdraw from the world. They tend to spend more time in bed, they sleep more, they're disengaged with wanting to watch television, concentration is reduced, there's a gradual decline in interest. What also can happen is that they tend to sleep more, and that day and night can blur. And that can raise issues if they tend to be sleeping more during the day and not at night, and being wakeful and potentially agitated because they can't sleep at night. Often we see breathing changes with our patients. This is very normal and it can be quite alarming at times. Patients can develop rapid periods of rapid breathing or shallow breathing. Linked to breathing changes, secretions can develop on the chest or upper airways. This can be quite alarming for us as carers, but also the families where the breathing is quite noisy. And this is often termed as a death rattle. This is just where our patients are mostly prone in bed, and you get a pooling of secretions in the lung tissues and airways. And because they're prone, they're not able to cough, sit up, and expectorate. If they're causing any distress to the patient, and if that is the case, then it's quite common to administer some medication to assist with those secretions. So as carers, if we identify that as an issue, then we need to be able to summon help as soon as possible. Quite often, a change of position is useful in actually loosening up of those secretions, and that can often help. But as I said, the key thing is making sure that the patient is not agitated and alarmed by those secretions. And quite often you can see from a patient on the facial expressions, if they've got a furrowed brow or they're agitated or hot and bothered, that sometimes their secretions are causing them distress. Temperature changes can occur with those very poorly patients. This is completely normal, where you have skin changes. Patients' skin can appear cool or quite warm at times, vary between the two, and colour changes can occur from being very pale or to a mottled, reddy, blotchy areas on their limbs. Also, you can get some discoloration in their lips and their nail beds, slightly sort of cyanosed or blue, which is like a blue tinge. Again, this is really very normal. Symptoms can increase, especially pain. If that patient has had pain issues before, then they are likely to remain or even worsen. It's quite common for patients to feel generally a degree of discomfort if they've been in bed for a long period of time. Yep. Now, as carers, our role is it's important to assess our patients, if that is the case, when we're doing our personal care. If we are turning them, delivering any personal care, then we just need to be mindful if we're noticing any increase in pain. And if that is the case, then that action needs to be, some action needs to be carried out in actually alleviating those symptoms. Now, agitation is a sign that occurs quite commonly in the latter stages of the process of dying. Now, this agitation is really very significant, and as carers, you need to be able to assess your patients and just to report any changes that you're concerned about. Now, agitation for the very poorly patients can involve a multiple of things. The patients could be agitated because of chest secretions, because of pain, because they're too cold, too hot, or whether they need their bladder emptying or their bowels being evacuated. So quite often we have to sort of think for our patients and just to rule out any potential agitation. Please don't hesitate in calling your district nurses, calling the GP surgery, calling the hospice at home for advice. Thank you for listening.